Now, in earlier conferences, I had talked to you about our vaccine supply, and you'll recall early in the pandemic, we had several instances where vials were broken and doses were wasted. Well, unfortunately, because of lack of local demand, and despite our best efforts, on September 21st, we had to return 3,000 doses to the state of Tennessee. That was the Johnson & Johnson vaccine, because those 3,000 doses had reached their expiration date. Now, I want to give a bit of context. These were doses that were shipped to us at the beginning of April, on April 5th to be exact, as a part of a 21,000 dose shipment. And you'll recall that on or around the 13th of April, the CDC halted administration of the Johnson & Johnson vaccine. About 10 days later, they began again giving us the authorization to do those vaccine administration, but there was some hesitancy in the community, and we've seen that lingering. We have, since that time, offered the Johnson & Johnson vaccine at every community drive-through site, at every community-based pod, and now there have been more than 100 community pop-up pods, at all of our homebound and homeless efforts that we have underway, and we've given more than 12,000 vaccines in that campaign. And we have also taken efforts to transfer Johnson & Johnson to other municipalities, other agencies, both public and private, who requested it, including a transfer of up to 7,500 doses to North Carolina just last month, and shipments to both Fayette, Tipton County, and within Shelby County. We've been in constant dialogue with the state since we received these doses and we saw the low uptake. We asked if there was a potential for the expiration date to be extended, and there was none forthcoming. And so we have known this day was coming for quite some time. We have done everything we can to get people to take the vaccination. And unfortunately, because of that lack of demand, those 3,000 doses had to be returned to the state and are expired. Now, there have been stories in the national news and local news about what they're calling wasted vaccines. I want to assure you that to this point, the Memphis Fire Department and our partnership through public vaccinations have delivered more than 300,040 vaccines. So right about 1% of those doses haven't been able to be administered, including these 3,000. And along the way, there are another 500 that were suspect due to either a cracked vial, or you'll recall back in the summer, or actually in the spring, there were vials of Pfizer that we were required to get 6 doses out of, but because of the needles that were provided, we could only get 5. That aggregates up to 500 doses that we were not able to administer. So about 1% was not able to be administered. That is significantly lower than the national trend and even the trend in our state. So, but in fairness, we wanted to offer that up to you as we've been transparent this entire time.